Our next question here, if someone has moderately elevated cholesterol levels, but maybe no other risk factors, do you think they would still need treatment?
Yeah, that depends. We use what's called risk enhancers. So, if there's one of these blood tests that I talked about, they show that maybe the patient has some other risk, or let's say they had premature menopause, which is a risk factor, or high lipoprotein A, or uh, other things. The blood pressure is a little elevated, but they don't, that's a risk factor. But we look at some subtle things that are not always obvious that may, even like psoriasis or inflammatory diseases, can be another risk modifier. So we look at it all, and then it's a patient doctor discussion. You have a moderately elevated LDL cholesterol. We decide, okay, is it lifestyle with exercise and diet, or do we add medications at this point? I think it's a combination of both, and it just depends on what the patient wants to do at this point. If they don't have a lot of risk factors, we have guidelines that tell us what to do, but it's a patient-doctor discussion to say, I'm worried about my heart disease because I know most people die of heart disease as number one cause of death for everybody in the world. So maybe we should start earlier. So we have that discussion and decide about medications or not at that point.